Hey everybody, this is Casey. I just wanted to talk a little bit about the recent healthcare passing of healthcare, the new healthcare bill, and just apply it to this context of libertarianism, fascism, and socialism. So let me just use the context first. I've got a little drawing board here that I just wanted to again keep us in the same frame of reference for some of the stuff I like to talk about usually. When we look at socialism, we're talking about the goal of government being to lend a helping hand to everybody. So it's sort of like government is there to take care of us, and so that's the context I'm coming from when I talk about socialism. The economic model for socialism is central economic planning, and ownership of everything is by the government, and therefore it's sort of an authoritarian role of government there. They tell us what to do. They own all the property and stuff. Um, so, and if we look at fascism, really the idea of behind fascism is to play favorites. So if you look at Germany back in the around the Second World War II, the idea was to play favorites towards the Aryans and the Germans, and the form of fascism that we have here in the U.S. is to play favorites towards whoever lobbies for the most favoritism. So you've got a central economic system, but it's dominated by private corporations or interest groups rather than the government actually controlling everything. It's these large corporations that are controlling everything. Interesting thing that I just was reading about was that when we talk about lobbying in the United States, there's actually 146 countries that have lobbyists in the USA. And then obviously everybody thinks of the large corporations as being the other lobbyists. So when you think about who's got the favoritism in the USA, you look at the lobbyists, and in a lot of cases it's other countries who are vying for favoritism from our own government. So I thought that was sort of an interesting revelation there. And then, of course, everybody's aware of, for example, the healthcare industry. If we look at the insurance companies, then there's a lot of lobbying going on there. Pharmaceuticals, same thing. So now if we look at libertarianism, sort of the guiding philosophy is leave me alone to live my life. And the economic system is a free market economic system, which would not have any sort of lobbying influences like we have in a fascist system. But the free market would literally be that your capital and your power comes from your ability to have good ideas and work those good ideas to where they make you an income. If you have a bad idea, then you don't make any money, and you have to find something else to do. So, interesting quote here. The dominating principle of who actually runs the government is the individual rights are what runs the government. And this is sort of a paraphrase from Ayn Rand, but it's the quote is, "The smallest minority is the individual. Those who fight for minorities must fight for individual rights." So if you look at somebody who claims to be in favor of minorities, but not in favor of individual rights, then what you're really looking at is a groupthink or a lobbying attitude. So if people are not willing to fight for individual rights, then you're shifting into more of this fascist idea of you're fighting for a group of people, and you're fighting for favoritism for groups of people rather than just having a fair, equal playing field for everybody as individuals. So, anyhow, I wanted to apply this to healthcare and get some debate going on that. What I find is interesting is that the healthcare bill that just passed requires everybody to get health insurance. So, if we were to say, okay, well, what would that look like? What system are we choosing to go with if everybody has to buy health insurance? Well, obviously, it's not a free market policy, because a libertarian point of view would say, hey, I should be left alone to choose whether I want to pay for health insurance or not. So Obviously, we're not looking at a free market solution with this healthcare bill. Um, if we look at fascism, where we're playing favorites, um, it's likely that these 30 million people who are now going to be put on insurance are going to be put on to some of the private insurance companies. So the insurance companies are going to win out here. They're going to make more money now that everybody's required to buy their insurance. And of course, the government is saying, well, you can also opt for the government plan. So there's a little bit of a socialist viewpoint on that. Now, I would default that to fascism right now because you still have a private option and a public option. So really, the two systems that are going to win out from this healthcare bill are the socialist system and the fascist system in the short term, and we'll see how that goes. If you look at these three systems as on a spectrum, then you've got trends that go from left to right, and it'll be interesting to see. The original effect of this new bill is that it's going to support sort of a fascist approach where the insurance companies are going to make even more money as people are required to sign up for plans. But in the long term, it'll be interesting to see if those private companies actually get pushed out of the business as the government-run plan becomes funded by the people and therefore becomes a more natural choice for everybody. Why would I want to be taxed for a public plan and then pay double to pay into a private plan? So there will be a natural tendency towards socialism, but we'll see where that's years off. So we'll see where that goes. Anyhow, I'm doing this just to sort of help people get clear on where we are as a country. Everybody's talking about capitalism and blaming free market capitalism for a lot of our woes. But if you take a closer look, then really what you'll see, especially with the lobbying in Washington, is that most of the aspects of our life are more of a fascist model right now, at least on an economic level. So anyhow, I hope that gives you some clarity. The free market approach would be totally different, and it would be closer to what we had 30 or 40 years ago. If you go talk to some people who are from the older generations, they can give you a good idea of what healthcare used to be like, and also tell you how cheap it used to be. Unfortunately, there's so much frivolous spending right now that's covered under healthcare that the entitlement to that frivolous spending is what's causing all these costs to go up for healthcare. And when people pay out of pocket, then they think twice about all the services that they're buying. So perhaps heading towards a free market solution would bring the cost of healthcare down. Obviously, this healthcare bill didn't really address the cost of healthcare. It just addressed the coverage issue of making sure everybody's covered. So we haven't fixed anything in terms of getting the cost of healthcare down. So hopefully that'll be the next piece that we start working on politically and economically. And thanks for listening, and I'll talk to you again soon.